Hi, I'm Terry Franzine. I'm the board chair of Haiti Companions, and I'm coming to you today from my home in Jasper, Georgia. When Dr. Diane Pisey and I co-founded Haiti Companions in 2007, we did so to help improve the health of the kids who attended the Episcopal schools which our respective Episcopal churches supported. If the kids were not healthy, then they weren't able to go to school. Education was the key to helping these children and their families climb out of extreme poverty. Over the years, our clinics expanded to include not just American medical providers, but also to provide jobs for Haitian providers and lay people. In 2015, we took the gigantic step to incorporate as a separate nonprofit entity, separate from our churches, and to hire an all Haitian staff. Since then, through the leadership of our country director, Dr. Franz Codillo, our clinics have expanded to a third location, providing monthly clinics at each of these locations. We employ 14 people to staff these clinics, including primary care doctors, a dentist, an ophthalmologist, nurses, and lay people. This last year has been a challenge, as Haiti has faced COVID like the rest of the world, and in addition has experienced civil unrest. Haiti still has no vaccines, but our staff perseveres and serves our communities. They educate our patients about how to protect themselves and their families, and we have provided masks to our patients. We now have approximately 3,000 patient visits annually. Without your support of Haiti Companions, our patients would have no medical, dental, or eye care. Their lives would be much worse than they are. We thank you from the bottom of our hearts for your support. And now I'd like to introduce Dr. Franz Codillo, our country director.
My name is Franz Codillo. I am Haiti Companions country director. I was born and raised in Haiti, especially in Carrefour, west of Port-au-Prince, which is the capital of Haiti. Where I grew up, there was an orphanage where American people used to come, and that's exactly where I picked up the language by helping them.
I was in high school, and one day, after playing soccer, I was on my way to go home and saw a woman fell, bleeding after being hit by a man. First, no one was able to help her. Secondly, no clinic or hospital around that area could help her, so since that day, the idea to become a physician was on my mind, intending to be able to help those who need medical help but can't afford to pay for it. After high school, with God's help, I started medical school in Port-au-Prince, where I met my lovely wife, Sharon Pierre. In general, the economic situation in Haiti is pretty precarious. The latest official poverty estimate in 2012 suggested that over 6 million Haitians lived below the poverty line of $2.41 US per day, and more than 2.5 million fell below the extreme poverty line of $1.12 US per day. The poverty gap between urban and rural areas has increased. In most rural areas, there is no governmental representation to help the people while they have a job, no food, no drinking water, no clinic, no hospital, no school, and very often they don't have a job. There were 25 physicians and 11 nurses per 100,000 population. Some of those healthcare professionals left the country, which makes it harder and harder for most Haitians to find healthcare, especially the ones who are living in the rural areas. So most rural areas have no access to health care. And Haiti Companions' mission is to provide medical, dental, and eye care to 3 communities, which are Cullen, Jasmine, and Tibucan. I have been working for Haiti Companions since 2014. First, as a medical provider at a twice yearly clinics that used to be done where we served 1,500 patients. And then, in May 2016, as the country director, when Haiti Companions, through 100% Haitian providers, started doing clinic once a month at each of the locations where we do clinics in the schools. We have 3 doctors, 1 dentist, 3 nurses, and 5 supporters.
My name is Sharon Pierre. I'm a physician. I choose to become a physician because of my dad. He was always inspiring me to become a doctor, to help people in my country, especially in my community. I choose to work for Haiti Companion because I see that what they are doing in the mountain for the people are very, very helpful for them. Why I said it's very helpful is because people here don't have enough money to go to the health facilities. Most of the time, the health facilities are very far for them, and the services that they are offering are too expensive for them. So I see that to work for Haiti Companion is can I say, it's an opportunity to help those people who are very in need. Thanks to all of you for your support.
This is Dr. Evelyn Pierre. She's the ophthalmologist for Haiti Companions here in Haiti. And we're glad to have her, and we're going to ask her a few questions. Doc Evelyn, comment vous? Très bien, grâce à Dieu. I just asked her how she is, and she said she's good. And yourself. Doc Evelyn, pour que tu choisi faire médecine, why did you choose to be a doctor? I chose to be a doctor because since I was a child, I really liked to help people, sick people, so that they could get better. Et pour qui sont choisi travail pour Haiti Compagnon? And why do you choose to work for Haiti Companions?
Ophtalmo comme si les spécialisés qui fait au plan, donc les femmes là, donc il pas déranger, donc dès qu'on première expérience, donc nous pensons que capable toujours faire expérience jusqu'à capable aider les gens qui pas capable.
The same reason I chose to be a doctor to help people is the same reason that brought me here in this remote area up in the mountain. The first time I came here, I had a great experience. And then I saw the people, I think they need help. So as a specialist, I agreed to come up here and everywhere Haiti Companion works to help those people who are greatly in need. Merci un peu, Doc Evelyn. Thank you, Doc Evelyn. This is Dr. Evelyn Pierre. She's the ophthalmologist for Haiti Companions, the eye doctor. And she's asking some questions to the patients.
wap di mwen, eske di wè bien? Alo.
Actually, she's giving glasses to the patient.
Eske wè de pi? Eske wè de bo?
The patient has difficulty
Avèk monsa.
to read, so Dr. Evelyn is giving him reading glasses.
Yade di sa yo? Ge, kon sa nan kamite nan sinan.
This is Emmanuel Bastian. He is the dentist for the clinic.
Or clinic là, run communauté par policy en pile service.
The clinic helped the community a lot.
Parce que dans l'espace que tu quitté, zone côté à gain pas de corps pour t'apprendre moto, tu es capable de faire accident.
Some of them don't have money to take motor, they could have accident.
Pour obliger la ville, les enfants au corps pour une consultation et en plus l'autre bagarre encore.
For them to go in the city, they will have to have money to pay motor, so they will have consultation.
Nous avons une considération pour les gens de service qui viennent en communauté. Nous pensons que tout le monde remet service là que compagnon en bail.
So everybody in the community is very appreciative for the service that they give.
Pour clinique dentaire là, nous travaillons par bon ici 3 fois par mois.
For the dental clinic, we work three times a month.
Et moi, je voulais expliquer nous parce que nous travaillons chaque 3 mois par mois ici.
We work every 3 months around here.
Et je pense que ça aide les gens en pile parce que le temps pour descendre en bas, pour aller au dentiste, ça coûte cher.
Yeah, that helped them a lot. If they would go to the city, that would cost them more.
Sauf que nous avons besoin de matériel en plus.
All we need is some material for the dentist.
This is Stephanie William. She's a nurse. She's the one responsible for the pharmacy for Haiti Companions.
What do you think about the clinic?
Ça m'a pensé de clinique là, surtout dans la question médicaments.
What I think about the mobile clinics, especially about medication.
Les patients viennent là, ils viennent consulter le docteur. En pile là, ils ne peuvent pas acheter des médicaments. Mais Haïti compagnon viennent comme un sauveur dans la communauté, ils baillent des médicaments gratuits.
When the patient come in, some of them could not buy the medication. When some of them come in, they get the medication that help them a lot.
Les viennent consulter là, ils ont toujours des médicaments, donc ça a toujours côté un paquet de changements, surtout pour les gens qui font attention, les gens qui font sucre. Donc ils ont toujours des médicaments gratis là, à ça médicaments ça aide avec traitement que y a suivre avec médecin.
So some of them come here, they get medication and they get treated, so that help them a lot.
Ok? Et comme si pour la communauté chrétienne, Haïti Compagnon, c'est une bénédiction, c'est un sauveur lié pour la communauté.
For the community and grace here, Haiti Companion is like a blessing from God.
My name is Asmid Reman. I am a nurse. I chose to become a nurse so that I could help my community and my country. I am a member of Haiti Companions so that I could help the ones who are in need my help as a nurse. Thank you. My name is Fénis Etienne. I am a registered nurse. I chose to become a nurse so that I can help my country and help my community and help anywhere else I could be. I chose to work for Haiti Companions. It's a passion for me to work with people who are living in the remote areas. They can't afford going down the city to seek for medical help. Thank you for your support to Haiti Companions.
The conditions of the roads to get to the clinic, mostly Tibuca and Jasmine, are just terrible. The patients and staff have to ride on a motor to get to the clinics, but riding on a motor is very dangerous and anything could happen anytime. Some of the staff members already fell from the motor but were not hurt badly. Patients pay a fee, which is 50 goods, about 50 cents US. But if the patient can't afford to pay that fee, he or she will still receive care anyway, because the goal is to help giving care to the needy ones in the community. The fee received from the paying patients, 85% of it returned to the community through the church or the school that hosts the clinic, and 15% is kept to be used for any patient we think that needs to seek more medical help elsewhere. So 100% of the fee paid by the patient returned to them. Medicines, lab tests, etc. are being provided by Haiti Companion. In March 2020, we started having some cases of COVID-19, and it was a panic in the country. Some medical personnel refused to see patients, stayed at home, but Haiti Companion staff didn't stop working even for one day. We educated our patients about the pandemic, encouraged them, and showed them how to wash their hands, wearing a mask, etc. We distributed face masks to them so that they could protect themselves and their family members. As of April 29, 2021, in Haiti, we have been able to test 63,000 people. Among those 63,000 people, we had 13,000 confirmed cases, about over 2,000 recovered ones, about 1,800 still in hospital, and we had about 263 deaths. Unfortunately, most Haitians think we don't have COVID-19 in Haiti and wear the mask unless they are forced to, like you can't get in some markets, some hospitals, some clinics, etc., without wearing a mask. Haiti Companions Clinic is very helpful for those communities, and if it didn't exist, most of the patients would have to go downtown to see a doctor. First, they will have to pay the motor taxi to transport them, pay the consultation fee at the clinic they will go to, pay for the lab exams, buy medicines, and then pay for the motor taxi to take them back to the mountain. So the Haiti Companions Clinic means so much for them because they can't afford paying what it will take to go elsewhere. Collins Clinic is about a 15-minute walk from the National Street, so it is closer to the city. It is hosted by an Episcopal school in the community of Collins since May 2016. And we have our clinic, general consultation, there every second Saturday of every month, and every other month we add a dental and eye clinic. Since launch, we served over 1,400 patients. Tibucan's clinic is way up in the mountain, and it's about 1 hour and 30 minutes walk from the National Street. We started that clinic 8 months after launching Jasmine and Collins Clinic because we realized that we have been seeing many patients from that location at our clinic in Jasmine. And when we interviewed them, they told us that they have to wake up at 4 or 5 a.m. and walk 2 to 3 hours to come to the clinic. So we decided to go to them instead. The clinic at Tibucan is hosted by a school in the community since March 2017. We have our clinic there. We do general consultation every third Saturday of every month, and every other month we add a dental and eye clinic. Since launch, we served over 1,300 patients at Tibucan. The clinic at Jasmine is about a 1 hour walk from the National Street, and it is located in the mountain. Jasmine is one of the remote areas where we do the clinic. It is hosted by an Episcopal school in the community of Jasmine since May 2016. We have our clinic there every fourth Saturday of every month, and every other month we add a dental and eye clinic. Since launch, we served over 2,600 patients. Since Haiti Companion started, we served in our 3 clinics over 5,300 patients, with about 3,000 visits, meaning returning patients, and keep having new patients who are coming so that we can help them. We just want to thank all of you who have been supporting Haiti Companion so far, and we hope that the partnership will continue so that we can keep serving those people in those remote areas, the ones who can't afford seeing a doctor. Thank you.
Rose Vanelli Rosier. Bon, m'a venu là très longtemps. Clinique là fait un pile bagaille pour moi parce que moi, je prends médicaments, ils font un pile bagaille pour moi. Ils font un pile effet dans la vie parce que les malades, ils viennent là, me médicaments, moi, je guéris.
Mais comme vous payez ici, est-ce que vous pensez que notre propriété carrée, vous avez besoin de ça?
Bah, ça sont gratis pour moi, mais pas comme payer là pour ça. Bon, il présente une clinique mobile pour le capable utile pays. Il dit compagnons utile nous en pile dans la communauté. Bon, bah là t'as pire pour moi parce que c'est comme t'as un gros cop pour me d'aller de l'autre côté. Ça souhaité pour lui toujours être là avec nous pour capable d'aider nous toujours. Bon, qui dernièrement gain pour lui, moi dis à Haïti compagnon merci beaucoup.
Oui, bonjour. Petit homme loisilien. Ah, ça fait très longtemps que je vis dans la clinique là. La clinique là fait un peu de bagaille pour moi parce que moi j'ai un médicament très efficace. Donc moi, là j'ai une petite douleur, moi venu, moi bois, moi ça fait beaucoup. Oui, alors moi je ne connais pas pour l'autre peuple qui est ensemble avec nous, mais pour nous-mêmes, alors c'est bien. Alors moi souhaite que pour l'équipe là toujours continuer. Et pour ne pas lâcher, donc, pour être capable de rester là, dans la clinique, pour ne pas décourager. Alors nous-mêmes, nous sommes capables de faire plus pour nous toujours. Donc nous-mêmes, ça nous avons bien pour l'équipe de nous, au côté pour être capable de faire une grande clinique. Donc nous-mêmes, nous venons pour être capable de côté pour nous stable. Alors pour nous-mêmes, c'est ça que nous sommes capables de faire. Et après, nous sommes capables de faire plus que toujours. Et puis faire plus de bagailles. Et comme ça, zone la résolue. Et comme ça, l'équipe la résolue plus que toujours. Nous-mêmes, pour nous-mêmes, nous satisfaisons beaucoup. Bon, nous avons remarqué pour l'équipe la rester là pour ne pas déplacer. Son grand éveil, parce que moi, son grand éveil, les nous sommes malades ici. Donc, parfois, c'est descendre pour nous descendre. Mais les nous descendent, peut-être que les nous descendent en bas, nous pas un médicament, nous montons. Et les nous pas. Nous mal bas, mais pour maintenant, l'équipe compagnon venir là, nous-mêmes nous satisfait beaucoup. Nous une équipe qui est grande pour la communauté. Hein? Donc nous félicitons. Donc nous félicitons. Donc nous avons remarqué. Et pour l'équipe compagnon toujours été. Et souterrain pour le travail. Donc pour ce qu'au dernier jour, le monde est venu tout. Alors pour capable élever nous. Alors pour moi-même, c'est bravo. Alors, féliciter l'équipe compagnon, donc pour toujours été mais avec pas petit boucan. Et avec nous avons belle docteur ensemble avec nous là tout aussi, François Dio, donc avec toutes belles mesdames. Donc nous félicitons. Alors pour nous-mêmes, nous pas de mots pour nous dire. Donc pour nous-mêmes, nous sentons bien. Et médicaments, ils font nous bien. Et nous-mêmes, nous, équipe là, c'est une équipe qui est très gentille. Et nous-mêmes, nous mettons ensemble avec nous travail. C'est rester là, travail, avec tout, pour élever la communauté. Alors, pour nous capables de l'autre côté, bon, nous ne pouvons pas arrêter là tout le temps. On a une clinique par nous. Donc, nous devons mettre l'argent. Pour chercher l'argent de l'autre côté, pour le mettre dans mes frères de l'eau. Alors, pour battre une belle clinique, nous-mêmes, nous venons pour une côté pour nous installer. Alors, les femmes ont dit bravo. Merci, bon Dieu. Alors, féliciter les compagnons. Alors, me dit merci beaucoup.
Hi, I'm Sandra Durbin. I live in St. Petersburg, Florida, and I have been on the board of Haiti Companions for over 5 years. I first experienced Haiti in 2009 and fell in love with the people, and then became acquainted with Haiti Companions through my church in Atlanta, and just really loved the mission of what we do to provide medical care to Haitians and having Haitians serving Haitians. We really appreciate your support of our mission, and thank you so much for everything that you do.
Hi, I'm Diane Pisey, a retired pediatrician living in Minneapolis, and I'm the Chief Medical Officer of Haiti Companions.
And I'm Cynthia Miller, and I also live in Minneapolis. I'm a clinical research nurse with a degree in public health, and I'm the secretary of the Haiti Companions Board.
Between 2008 and 2016, Cynthia and I worked with medical teams twice a year in Haiti. Then in 2016, Haiti Companions decided to turn the clinics over to the Haitian medical providers. But we've remained interested and involved. And one of the things we do each month is to review the clinic logs, where the physicians record the diagnoses of the patient they see.
So I take the logs that the physicians sent us at the end of each month and enter them in Excel, and then make charts of some of the most common diagnoses that we're seeing and the numbers of visits people make who are seen for different diagnoses. And through that, we're able to look at what the most commonly treated illnesses are in the clinics across the 3 locations. You can see from this chart, acute respiratory infection is one of the most common things we see. So 25% of the visits are adults and children with acute respiratory infection. The next most common is hypertension, and hypertension is a big problem in Haiti. And one of the things we're so happy about with the clinics is that people with hypertension are able to come regularly and be seen, have their blood pressure monitored, and receive medication to control their blood pressure over time. Anemia is another problem that we're seeing both in adults and children. Dermatosis is very common, so skin conditions of various kinds. Gastritis is also quite common, particularly in adults, and parasites of different kinds in both adults and children.
So besides hypertension, the other chronic disease that the physicians are treating is type 2 diabetes, which is also fairly common in Haiti. Many patients have both hypertension and diabetes. And the very small fee that the patients pay, which they pay only if they can afford it, allows them to see a doctor, a dentist, and an eye doctor, and to receive whatever medications they require. Patients with hypertension and diabetes are seen once a month, and they always receive enough medication to last for a whole month. Because of this close monitoring and regular medication, the risk of complications such as stroke, heart disease, and kidney failure are greatly reduced.
Thank you so much for your support. It is helping so many people live healthier lives.
Harry Laborde is a great friend of many of us at Haiti Companions. He grew up across the street from the Episcopal Church of St. Philippe St. Jacques, and his father is the lay leader there. And Harry and his brother have taught at the school. And we see Harry every time we visit Haiti and have loved watching him grow up. But most of all, Harry is a fabulous musician. And now we have a big treat for you as we share this song by our friend Harry Laborde.
Derrière yon gros touffe pingouin, l'autre jour m'rencontre Choukoun, les souris les li ouais moi dit ciel à la belle moun, moi dit ciel à la belle moun, li dit mou trouver sa chère, petits oiseaux, tape écouter nous dans l'air. Oiseaux, t'as pu écouter nous dans l'air. Quand moi songe ça, moi gagne la peine. Car depuis joue ça, depuis moi dans chaîne. Quand moi songe ça, moi gagne la peine. Car depuis moi dans chaîne. C'est un marabout, j'ai éclairé tant coup chandelle, il gagne un tété de bout, assis choukoun de fidèle, Asi choukoun de fidèle, nous était causé longtemps. Ti oiseaux, un bois te paraît content. Ti oiseaux, un bois te paraît content. Puis t'oublier ça, c'est trop grand la peine. Car depuis jour ça, depuis moi l'enchaîne. Puis t'oublier ça, c'est trop grand la peine. Car depuis moi l'enchaîne. Puis t'oublier ça, c'est trop grand la peine. Car depuis jour ça, depuis moi l'enchaîne. Puis t'oublier ça, c'est trop grand la peine. Car depuis moi l'enchaîne. Oiseaux, nan bois qui tape écouter. Petits oiseaux, tape écouter nous dans l'air. Quand moi songe ça, moi gagne la peine. Car depuis jour ça, depuis moi l'enchaîne. Quand moi songe ça, moi gagne la peine. Car depuis moi l'enchaîne. Quand moi songe ça, la peine, car depuis jour ça, depuis moi l'enchaîne, quand moi songe ça, la peine, car depuis moi l'enchaîne.
This is Randy Winningham. I live in Atlanta, Georgia. I serve as treasurer for Haiti Companions. I'm responsible for ensuring that funds go into the bank account. Money is sent to fund the 3 monthly clinics in Gressier, Haiti, and any bills for every charity are valid and paid. Last year, Haiti Companions had a budget of almost $50,000 to provide medical treatment to almost 3,000 patients in Haiti. The budget is funded entirely by contributions from the public, groups such as Duluth, Georgia Rotary Club and Pickens County, Georgia Holiday Market, and Haiti Companions board members. Patients at the clinics also pay a very small fee if they're able to. They are provided care whether they can pay or not. All donations to Haiti Companions are spent on running the clinics, funding efforts, and getting the money to the clinics. We prepared the following breakdown of expenses from last year. This money is mainly used for the wages of medical and dental staff at the clinics. A small amount also goes toward necessary transportation costs to run the clinics. As for the fees paid by clinic patients, they pay for use of the schools where the clinics are held. In addition, the patient fees are used to provide aid to patients that need advanced or specialized medical attention that the clinics are not equipped to provide. These funds are usually provided to parents of children in health distress when they have no money and nowhere else to turn to get help for their children. This money went toward prescribed medicine, such as antibiotics, and medical supplies, such as bandages and eye drops. A small amount of money also went toward delivering the medicine supplies to Gressier from the capital in Port-au-Prince. The medical director in Haiti maintains an office to store medicine, produce medical records for clinic patients, and generate financial reports for the Haiti Companions Board, since we track and audit how contributions are spent. In addition, our goal is to receive status as a non-governmental organization to allow us access to more sources of funds so that we can ensure the clinics can continue operating. The Haitian government requires an office in the country for consideration of that status. We strive to keep this part of the budget as low as possible. Haiti Companions board members receive no form of compensation. Administrative costs are confined to bank fees charged to maintain a bank account and to transfer money to Haiti to run the clinics, a few government filing fees, fees for the Haiti Companions website, and a subscription to Network for Good, which accepts donations via the internet and then remits the funds to Haiti Companions. We're constantly looking for ways to further reduce these administrative costs to make sure that as much money as possible is used to provide aid to the Haitian people. We thank you all for your support in providing health care to those who would not have access to it otherwise.
Harry Laborde's brother Jonas is an Episcopal priest in the Diocese of Haiti and also a musician. Before he was a priest, he and Harry and other friends formed the musical group Vocation, which means vocation. The group is dedicated to praising God through music. This song that we're about to hear was written by Harry's wife, Marie Cataline Lindor. The song is M'pap fait rien sans bon Dieu m'nan, which means I will not do anything without my God. Enjoy the wonderful music of Vocation.
Vocation Haïti, on chante pour nous bailler, bon Dieu gloire. Pas faire un instant, bon Dieu maintenant. Compromettre volonté, parce que les marchés avec le sentiment bien, dans la volonté tout bagaille bien. Tout bagaille bien, l'enfer sans mon j'aime marcher avec vous. Bon Dieu, fidélité ou sans pareil, ou pas de limite, comme les amis ou marcher avec vous.
The ones in the remote areas I've been talking about, they are right behind me, where we are working now. And
If we don't come, they will not be able to see doctors. If we don't come up here, they will not be able to see the nurses. They will not be able to get their high blood pressure under control. So we are here to help them. We became a doctor so that we can help these people. The ones who can't even afford having the fee to pay the motor taxi to take them down to the city to see a doctor. And getting down to the city to see the doctor, they also need to have the kind of money required to pay to visit with the doctor. So instead of going down the city, we come up here to see them, and we are so thankful to be able to help them. And we count on your support to keep doing this work. As the country director, I just want to thank you for your support to Haiti Companions, because without you, these people will not be able to see doctors, nurses, dentists, and so on. So we just thank you.
Thank you so much for spending your time with us tonight learning more about Haiti Companions. Our patients and our staff know that there's no way that we could have the clinics without your help. So thank you so much for any donation which you will make tonight or tomorrow or anytime. You can make your donations through our website and through Facebook. Merci un pile.